A report into the standard of NHS patient care at Stafford Hospital has been published today following a 31-month-long public inquiry. Initial concerns about standards at the hospital arose in mid-2007 following complaints from patients and their families. Today's report has identified several key findings at the hospital. The report has found that there was a severe shortage of nursing staff, with patients being left unwashed and neglected for weeks at a time, and that those in pain were given medication late or not at all. Misdiagnoses were also commonplace. The report has also found that hospital staff who tried to speak out felt intimidated by the NHS Trust, which was more concerned with cost-cutting and meeting targets. Today's report will have far-reaching consequences, as the standards of care at the NHS affect all of us. But what's been your experience at the NHS?
Well, I think, as the recommendations say, there's got to be a whole change of attitude within the NHS. It's got to get rid of the lists, the targets, the form filling, and get back to basic care.
Perhaps student nurses these days are thinking more about the academic side rather than the compassionate side, and maybe nurses that have been in the NHS for a long period of time are compassion weary. Perhaps they don't feel they have enough support from their management.
I think it's terrible, to be honest with you. You'd have thought with the NHS, all the money that's been pumped into it, there would have been a bad negligence. There'd be more boundaries and more be done against negligence and things like that, really.
To be quite frank, it shouldn't be allowed at all. It shouldn't happen. The fact that hundreds of people suffer just because of people's negligence the NHS is run by the government, and it should be taken care of more.
So on the whole then, public opinion agrees with the recommendations of the report that we need to get back to basics and provide better care and get rid of the bureaucracy and the red tape which has been constricting NHS staff. But it remains yet to be seen what actually happens. Luke Newman for Solent Journalism.